Good morning, everyone. Welcome to today's update on COVID-19. Dr. Tam, Dr. Njoo, and Dr. Berthiaume are with us today. Bienvenue à cette mise à jour sur la COVID-19. Les docteurs Tam, Njoo et Berthiaume sont avec nous aujourd'hui. Alors, on peut commencer immédiatement. Dr. Tam, over to you.
Dr. Tam, you might be on mute right now. We can't hear you.
Thank you. Bonjour à toutes et à tous. There is concern that the increase in more transmissible variants is threatening our progress before vaccines can bring full benefits. To date, over 922,000 cases of COVID-19, including over 22,500 deaths, have been reported across Canada. Over the past week, there has been an 8% increase in daily cases, with an average of almost 3,300 new cases daily. Declines in lagging indicators of COVID-19 severity are also showing signs of leveling off or increasing slightly. On average, over the past week, 31 deaths were reported daily, and close to 2,060 people with COVID-19 being treated in our hospitals each day, including over 560 in critical care. To date, about 4,500 variants of concern cases have been reported across Canada, with the B117 variant accounting for over 90% of these to date. In some parts of Canada, variants of concern now represent a high proportion of cases, and the number of outbreaks involving these variants are increasing. Things will get easier if we keep COVID activity at manageable levels as vaccines continue to roll out over the coming weeks. At this point, Team Variant has the ability to take off fast. This is a crucial moment. If we don't slow down the spread of the variants, Team Vaccine is at risk of falling behind. But if we can hold on and give it that last push by keeping up with personal protective measures and limiting our contacts to the extent possible, we will clear the path for Team Vaccine to cross the finish line. There are encouraging developments with each new day. The rates of COVID are dropping in elders 80 years of age or older, with a downward trend in long-term care home outbreaks. Each week, a new high is being set for the number of COVID-19 vaccine doses administered, with over 670,000 doses of COVID-19 vaccines administered this past week alone, and more than 3.5 million doses administered to date across Canada. There have been recent reports in Europe of blood clots following vaccination with the AstraZeneca vaccine. Health Canada has been working closely with international regulators to gather and assess the available information, and has determined that the AstraZeneca vaccine has not been associated with an increase in the overall risk of blood clots. Rare adverse events are expected to be detected when vaccines are given to millions of people. They must always be taken seriously and investigated thoroughly. It is possible that the vaccine may be associated with very rare but serious cases of blood clots associated with low level of platelets, which merit further analysis. Health Canada will continue to work with international regulators and review data and evidence as it becomes available, including as it pertains to these rare events. Overall, the benefits of the AstraZeneca COVID-19 vaccine in protecting Canadians from COVID-19 continue to outweigh the risks. Ensuring that all vaccines authorized for use in Canada are safe is a priority for health authorities across Canada, who continue to monitor, investigate, and report through countrywide vaccine safety surveillance systems. To date, there have been no safety signals of concern detected following vaccinations in Canada. As these vaccines work to protect more and more Canadians, Let's play our part by staying strong and helping each other, following public health advice, keep up with individual practices, and prepare to take your place in the queue when the time comes for you to be vaccinated. Thank you.
Bonjour à toutes et à tous. Il y a des préoccupations que l'augmentation de cas de variants plus transmissibles ne freine nos progrès avant que nous puissions profiter pleinement de l'avantage de la vaccination. Jusqu'à présent, plus de 922 000 cas de COVID-19, dont plus de 22 500 décès, ont été signalés au Canada. La dernière semaine, nous avons constaté une augmentation du nombre de cas quotidiens de 8 soit près de 3 300 nouveaux cas par jour en moyenne. La baisse du nombre des indices de gravité tardif de la COVID-19 montre également des signes de stabilisation ou de légères augmentations. La dernière semaine, 31 décès ont été signalés en moyenne par jour et près de 2060 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont plus de 560 étaient aux soins intensifs. Jusqu'à présent, environ 4 500 cas de variants préoccupants ont été signalés au Canada, le variant B117 représentant à ce jour plus de 90 de ces cas. Dans certaines régions du pays, les variants préoccupants représentent désormais une proportion élevée des cas et le nombre d'éclosions de cas portant ces variants augmente. La situation sera plus facile si nous maintenons la transmission de la COVID-19 à des niveaux gérables à mesure que les campagnes de vaccination continueront de se dérouler dans les prochaines semaines. À ce stade, l'équipe des variants a la capacité de prendre les départs rapidement. C'est un moment crucial. Si nous ne ralentissons pas la propagation des variants, l'équipe des vaccinés risque de tirer de l'arrière. Mais si nous tenons bon et fournissons un dernier effort en respectant les mesures de protection individuelles et en limitant nos contacts dans les mesures du possible, nous dégagerons le terrain pour que l'équipe des vaccinés remporte la course. Chaque jour qui passe apporte des nouvelles encourageantes. Le nombre de cas de COVID-19 est en baisse chez les personnes âgées de 80 ans et plus et le nombre d'éclosions dans les centres de soins de longue durée tend à chuter. Chaque semaine, un nouveau record est établi en ce qui a trait au nombre de doses de vaccins administrées. Plus de 670 000 doses ont été administrées rien que la dernière semaine et plus de 3,5 millions de doses ont été administrées au Canada à ce jour. Des cas de caillots sanguins ont été signalés récemment en Europe à la suite de l'administration du vaccin d'AstraZeneca. Santé Canada a travaillé en étroite collaboration avec les organismes de réglementation internationaux pour recueillir et évaluer les données disponibles et a déterminé que le vaccin d'AstraZeneca n'a pas été associé à une augmentation du risque global des caillots sanguins. Cependant, le vaccin pourrait être associé. Il est attendu que des efforts secondaires rares soient détectés lorsque des vaccins sont administrés à des millions de personnes. Ils doivent toujours être pris au sérieux et faire l'objet d'un examen approfondi. Il est possible que le vaccin soit associé à des très rares cas graves de caillots sanguins liés à des taux de plaquettes faibles, lesquels méritent une analyse plus approfondie. Santé Canada continuera de travailler avec les organismes de réglementation internationaux et d'examiner les données et les preuves au fur et à mesure qu'ils émergent, notamment en ce qui concerne ces effets rares. Dans l'ensemble, les avantages du vaccin d'AstraZeneca pour protéger les Canadiens contre la COVID-19 continuent de l'emporter sur les risques. L'ensemble des autorités sanitaires du pays ont comme priorité absolue de veiller à ce que tous les vaccins autorisés au Canada soient sûrs et elles continuent de surveiller, d'enquêter et de faire rapport aux moyens des systèmes de surveillance de l'innocuité des vaccins à l'échelle nationale. À ce jour, aucun signe de nocivité préoccupant n'a été détecté à la suite des vaccinations au Canada. Il est vrai que ces vaccins permettent de protéger de plus en plus de Canadiens, mais jouons notre rôle en restant forts et en nous entraidant. Suivant les consignes de santé publique, continuons d'appliquer des pratiques individuelles et soyons prêts à recevoir le vaccin le temps venu. Merci.
Merci beaucoup. I will now take questions. As usual, you can get one question and one follow-up, et vous pouvez poser vos questions, votre question et une question de suivi dans la langue officielle de votre choix. Operator, over to you.
Thank you. Merci. Please press star one at this time if you have a question. Vous pouvez appuyer sur étoile 1 maintenant pour poser une question. Our first question is from Mike Lecouteur from Global News. Please go ahead. À vous la parole.
Thank you for taking our questions. This is for Dr. Tam and or Dr. Njoo. Your first comments off the top saying that our progress is being threatened, and when we see that the variants are spreading very quickly, especially in younger adults, I wanted to sort of ask you this in two parts. Are you concerned that Canadians somehow don't understand the heightened danger at this time? And in your opinion, is it time for stricter guidelines for movement for people in different jurisdictions, because this is such a critical time and that we could be teetering here?
Yes, I'll take the first response to this question. Yes, there is an indication that after coming down that second wave, that downslope, we initially sort of plateaued at about 2/3 of the way down, and then we're now beginning to see an uptick in cases. And in particular, it's areas where variants of concern. These are variants that can be transmitted more easily, so they spread faster. And so that is the current concern. And there is a risk in different areas of Canada, not everywhere, that these variants could result in the disease activity taking off fast. So it is, as I've said, a pretty critical moment. And that, we seek for everyone to do the very best that you can to keep up with the local public health advice and protect yourself and your loved ones through these protective measures, which we said again, mask wearing, washing your hands, watch your distance as much as possible. We know that some people do have to work, some kids are going to school, but you need to do that really safely. And that does have to depend on the local epidemiology. But on the whole, we're just asking people to hold on for a bit longer because the vaccines are just escalating. Now is not the time, but this is not forever. And that I think that is really key. There is a sense of course, this has been going on for so long that many people are having some difficulties keeping things up. So I do think that this is absolutely not the time to let go of those measures.
It's Dr. Njoo. Maybe I'll just add a few additional points to what Dr. Tam said. I think we are all taking it seriously across the country. We're having active discussions at the Special Advisory Committee, and there are indications based on the data that we're receiving at the national level that, in terms of hospitalizations and ICU admissions, we're also seeing it happening among the younger age groups. So I think there really is a caution and a warning that, everyone is still at risk with respect to either coming down with it or transmitting COVID-19 to others. And so I think we really can let go. Just speaking personally here in the Ottawa area, where Dr. Tam and myself listened to what Dr. Vera Etches, our local medical officer of health, is saying. And because of the situation in Ottawa, getting worse, it looks like, I guess, stricter measures will be put in place. And so, as we've said, it depends on local epidemiology, but I think public health authorities across the country are taking it seriously. And yes, if there needs to be stricter measures put in place, I think they're prepared to do that. Thank you.
Thanks. Follow up, Mike?
Yeah, and just as a follow-up, when you talk about the spread of the B.1.1.7 variant and being more prevalent in younger adults, like I guess I wanted to follow up on the stricter guidelines. But do you think that there's a sense out there that because the vaccines are rolling out, that people aren't really making the connection? They think that the finish line is already there, even though they don't have a needle in their arm yet. And how much are you concerned that the spread will now be in that younger adult population that is harder to control or harder to get the attention of to continue to do those follow the public health guidelines?
Yes, I think we have to remind everyone that less than 10% of Canadians have received a vaccine, and they're mostly people, of course, in the higher risk groups, and therefore the older population. So it is a really tricky situation because of the spread occurring in the younger age groups, while they are the ones waiting further down the line to get vaccinated. And so, which is why the overall strategy in Canada is to get that first dose into as many people as fast as possible, for this very reason, that we need to not just focus on the high risk groups, but if we want to get this epidemic, break the back of this current wave, we have to try and get as many vaccines as fast as possible into the whole population. So it is something I agree that we have to do very specific and targeted outreach and communication to younger adults as a result, and that also encourage them, not too far down the line, by the way, that they should also roll up their sleeves and get the vaccine as well.
Yeah, it's Dr. Njoo. I think the issue of enhancing Canadians' confidence in vaccines, including younger age groups, is top of mind. I think we're pulling out all the stops, using all sorts of different mechanisms, be it training webinars for healthcare providers so that they can give good information to their patients, so they can make an informed choice, using various sort of social media and other types of campaigns to get the message across. And I guess also to see what local authorities are doing. We understand it in some provinces. They are actually starting to target younger individuals based on their local epidemiology with the vaccination campaigns, as at the same time, of course, they're focusing on the older age groups and the higher risk groups. So I think there's lots that still will be done. And as we get more, millions more doses coming into the country, that it will get, as they say, less and less of an issue as more and more Canadians take up the offer to become vaccinated. Thank you.
Thank you. Merci. Next question.
Thank you. Our next question is from David Thornton from CBC News. Please go ahead. À vous la parole.
Hey, so as more Canadians get their first shot, I'm just wondering, what does that mean for family and social gatherings, especially with, the Easter weekend approaching, even, Victoria Day in May? Does this change anything for people who have been vaccinated? So just wondering if y'all could comment on that.
Yes, well, Easter's just around the corner, and as I've said, that the epidemic may be resurging in different areas of the country. So this is not the time to have big gatherings. The vaccine is not 100% protective, and we don't actually know, whether protected people could transmit the virus. That being said, together with the chief medical officers, we are looking at how do we adjust public health guidance as more people become vaccinated, and trying to get everyone vaccinated with that first dose as fast as possible increases our chances as another layer of that protection, and to our defenses, if you like, on top of everything else that's doing, so it becomes easier for society to reopen and resume some of those activities. So I think all I can say is that things will get better if people do roll up their sleeves. The other but one of the first areas I think medical authorities across the Canada will first look at is the long-term care homes, and whether, of course, our seniors, having been in relative isolation for so long, that's really key to see what can be done in those settings to allow more social interactions, and how to protect the people, visitors coming in, and the healthcare workers. If we need to get the rates of vaccinations up in those who look after this population so that they can begin to have more of that social activity or connection. And so I think we will be watching, the progress, not just in vaccine uptake, but in the actual disease transmission or epidemiology in the community, because ultimately is that will drive how much interaction we can have. I think we will be going back to say when the weather is good, just get outside. And so those, the sort of higher risk settings remain the closed, crowded areas with poor ventilation. There will be more activities that can be supported outdoors as well. So we got to really give people some other thing, some of these kind of activities to look forward to, and like we did last year, in fact. So the vaccine, I think, will contribute to decelerating the epidemic, but it's not going to do it yet. So because we haven't got enough people vaccinated, so not Easter. Easter is not the time to have big gatherings, but with time, smaller social interactions. You may see some of the bubbles, sort of concepts coming back in, and this time with another layer of protection, which is the vaccine.
Thank you. Follow up?
Yes, so this follow-up is for Dr. Njoo because you work so closely on the vaccine logistics file. When are the AstraZeneca doses that we're getting from the U.S., when are they supposed to be used by? Just wondering if you can let us know that.
Thank you for the question. Certainly, although I work very closely with Major General Denny Fortin, I don't have line of sight. Those various sort of complex and very detailed logistical aspects, I would leave it to him. Certainly, I see the media reports as well in terms of doses that may be coming into the country, but other folks, obviously, lots of folks are on the file. Our colleagues, obviously, as well in procurement and so on. So I really don't have much to offer except that the more doses we get of any vaccine that's approved for use in Canada, the better, because then we can obviously move within Canada to get those shots into arms. Thank you.
Thank you. Merci. Once again, please press star 1 at this time if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 maintenant pour toute question ou commentaire. We have no further questions registered at this time. Nous n'avons plus de questions pour le moment. Je vous retourne la parole. Alors, pardon, nous avons une question de David Turton de CBC News. À vous la parole. Please go ahead.
Hi. Yes, I just wanted to circle back because you're taking more questions. That's great. We heard from NACI earlier this week if they would change anything when it comes to their advice, when it comes to their guidance on how AstraZeneca could be used. Of course, they've changed their advice. It can be used for people above 65 and older. And one thing that Dr. Caroline Quashtan said is that, one thing she might change is the way that this is communicated. And but that's not NACI's responsibility. That is PHAC's. So I'm just wondering, would you agree with this? Do you think that now that we're a year into this pandemic, that the way PHAC communicates information, the Public Health Agency of Canada communicates information, hasn't always been, up to par, and whether that needs to be improved?
Well, I think communication is extremely important in this response. One of the really key challenges is that information and science keeps moving at a very fast pace. So we can always do better in terms of supporting communications, particularly on somewhat complicated decisions and how they're arrived at. And so I think there will be more support to NACI, for example, in communicating their recommendations, including not just the publication of their statement, but a more plain language version of that. I think that is being envisaged and being rolled out. And so, and providing more technical briefing as a sort of regular occurrence, so that anytime those recommendations are put out, it's not just, well, what are the recommendations, but helping the public understand what led to the recommendations in the end. And the decisions are sometimes complicated. It's not just based on the evolving data. It's also based on the realities of the different products in Canada and the supply. And there's more than one vaccine, so those have to be taken into account by public health programming and officials. And so communication can always be better, is what I think. And we should do that. What is difficult, as I said, is this sort of every week or so there's another additional recommendation, and then how that fits in with the preceding ones, and what led to the change, I do think needs to be better communicated.
It's Dr. Njoo. Maybe I would make an additional point to what Dr. Tam has said. And that's the fact that there are many voices out there. And so I think that obviously as public health, we could always do better in terms of self-improvement. But I think the media also needs to understand in terms of the different perspective and voices out there. And I would say that there is a difference in terms of what Dr. Tam, myself, and the Chief Medical Officers of Health are saying and giving advice from, quote, a population and public health perspective, as opposed to maybe other voices out there, which are maybe looking from maybe a different, narrower perspective, a sort of an individual clinical perspective, et cetera, and so on. So I think it's just something we need to be mindful of, as well as we try to get, obviously, the best information out there to inform Canadians so they can make informed decisions regarding their health. Thank you.
Follow up?
Yes. I feel like I've won the lottery getting to ask all these questions. So this is my final question. The European Medicines Agency has said that AstraZeneca is safe to use, but it can't rule out a link to a small number of rare blood clots that were reported on the continent. And patients should be on the lookout for warning signs and that kind of thing. So I just want to know that, is there any messaging, we talked about communication just now, that you want to give to Canadians, again, even if you have to repeat it?
Yes. So I'm going to start, and we have our Health Canada colleague, Dr. Berthiaume, who may want to provide any additional information that he has because Health Canada has been the one linking up very closely to the investigations in Europe and the European Medicine Agency. So I do think that from a general communication perspective, it is really important to advise the public on what to expect. And first of all, we need to make sure everyone knows that mild and moderate side effects after a vaccine is to be expected. So the pain at the injection site, maybe fever, general tiredness, and muscle aches can occur. And are often are not infrequent, in fact, but they do resolve in 2 to 3 days. The second dose of vaccine can sometimes result in a heightening of those reactions, which is a sign that your body's immune system is actually doing its job and mounting that defense. What is also important for everyone to know is that rare but serious adverse events can occur with a vaccine, which is not necessarily seen in the smaller clinical trials, even though tens of thousands of people were included in those clinical trials. If the rate of occurrence is, a few cases in a million, you're not going to see that until large numbers of people get vaccinated. And we will always need to take those reports very seriously, and that there is a system which is international that is monitoring, as you've seen in the past days, these events, and they have to be investigated thoroughly. And after that, we need to then solidify the messaging that will need to be communicated to healthcare providers and those providing advice on immunization. So right now, what I said in my opening remarks is it is possible that the vaccine may be associated with very rare but serious cases of blood clots associated with this low-level platelets, those things that help your blood clot, which is undergoing further analysis. And so I think this will help. Whatever comes out of the further analysis will help people make an informed choice. So right now, maybe I'll pass the mic over to Dr. Berthiaume.
Thank you, Dr. Tam. Yes, I would be happy to provide a bit of additional information. So to answer your question, I think the key message is that Health Canada has actively looked into this issue, is in contact with other international regulators, and looking at the data, still considers that the benefits of the AstraZeneca vaccine outweigh the risk, especially considering the risk of complication and blood clots that are associated with the COVID infection itself. There is, when you look at the data around these very rare types of blood clots associated with low platelets, the information that was provided by the European Medicines Association is that there were 25 cases over 20 million people vaccinated with the AstraZeneca vaccine. So as Dr. Tam mentioned, these adverse events are extremely rare. There is a subset of those adverse events, 17 of those 25, that are called cerebral sinus vein thrombosis, that are continuing to be investigated. And as we look into them and in collaboration with other regulators, if there's any additional findings, we'll communicate to Canadian. At this point in time, we're actively monitoring, and I can assure you that everybody around the world is actively monitoring this issue. And if there's any conclusion, either to establish that it's not linked to the vaccine or that it is linked to the vaccine, we'll communicate that clearly to Canadians. So at this point, as pointed out, there is a potential risk of these very rare blood clots, but the causal association has not been established, but we're actively monitoring. But overall, if you consider the benefits of vaccination of the AstraZeneca vaccine, the risk of COVID out there in the community, we consider, Health Canada considers that the benefits of taking the vaccine, any vaccine, including the AstraZeneca vaccine, clearly outweigh any potential risks.
Thank you. Merci. Prochaine question.
Thank you. Notre prochaine question est de Juliane Lapointe de Radio-Canada. À vous la parole. Please go ahead.
Bonjour, je vais vous faire peut-être répéter un peu tout ça en français. Si c'est possible de nous expliquer pourquoi on dit qu'en principe, il n'y a pas de risque, que tout est sécuritaire, mais qu'il existe ce fameux risque de caillots de sang rares. Donc peut-être, si c'est possible, Dr. Njoo, de nous expliquer la distinction.
Voulez-vous que j'y aille, Dr. Njoo?
Oui, peut-être c'est mieux si vous commencez, Dr. Berthiaume.
Okay. Mais,
oui,
Oui, si je peux peut-être, c'est parce que malheureusement, parce qu'on fait de la télévision, c'est toujours mieux si on a quelqu'un à la caméra, puis avec un appel téléphonique, c'est moins bon. C'est possible d'avoir quelqu'un qui a une caméra ouverte.
Ben, ma caméra est ouverte. Je ne sais pas pourquoi ça. Moi, je me vois sur l'écran
OK.
dans la conférence de presse.
Ouais.
OK, c'est beau, parfait, allez-y. Je vous laisse y aller.
D'accord. Donc, la question, c'était dans le fond, qu'est-ce qu'il y en est de ce risque-là d'effets indésirables, des cas rapportés d'effets rares avec certains types de caillots sanguins et des taux de plaquettes basses. Alors, Santé Canada a émis hier soir tard un communiqué qui expliquait clairement que il y a eu des cas rapportés dans d'autres juridictions de certains effets indésirables très rares qui sont des cas de caillots sanguins associés à des niveaux bas de plaquettes. Les cas qui ont été rapportés selon l'information qu'on peut trouver, par exemple, qui a été publié par l'Agence de du Royaume-Uni sur les médicaments, c'est qu'on parle de 25 cas de ces rapportés de ces effets indésirables rares sur 20 millions de doses administrées du vaccin d'AstraZeneca. Quand on regarde ce 25 cas-là, il y en a 17 là-dedans qui sont d'un sous-type un peu plus spécifique, qu'on appelle, dans le fond, là, c'est une thrombose du sinus veineux, donc c'est une sorte de veine qui est au niveau du cérébral. Puis donc 17 cas rapportés sur 20 millions de doses. Mais c'est un peu plus haut possiblement qu'est-ce qui pourrait être anticipé parce que c'est un effet, c'est un syndrome qui peut survenir de façon spontanée dans la population en général. Fait que ça peut être rapporté en association avec le vaccin, ça peut survenir aussi. Donc, l'analyse des cas semble suggérer qu'il pourrait, en fait, qu'il n'y a pas eu de lien démontré entre ces cas-là et le vaccin, mais on continue à investiguer ces cas-là. Ce que je peux vous dire, c'est que globalement, initialement, s'il y avait comme des inquiétudes par rapport au taux des effets secondaires thromboemboliques avec le vaccin d'AstraZeneca, alors le taux global. Alors ça, quand ça a été analysé par Santé Canada, par l'Agence européenne, par l'Agence du Royaume-Uni, la conclusion, c'est qu'il n'y a pas d'indication que le taux global de caillots ou d'effets secondaires thromboemboliques est plus élevé avec le vaccin d'AstraZeneca que ce qu'on attendrait de façon générale. Donc, il n'y a pas de lien établi. Cependant, le sous-type de cas dont je vous parle, donc les cas de thrombose du sinus veineux cérébral, ces cas-là continuent à être investigués. On parle encore là, je veux le rappeler, de cas qui sont extrêmement rares. Alors, 17 cas sur 20 millions de doses administrées quand on regarde l'ensemble des données. En Europe, si on exclut les données de la Grande-Bretagne, le taux pourrait être un petit peu plus élevé. Suite à l'analyse de toutes ces données-là, puis Santé Canada est en collaboration et en communication étroite avec et l'Agence du Royaume-Uni et l'Agence européenne. Les deux agences ont réitéré le fait que ces cas-là continuent d'être investigués. Sur la base des données actuelles, il n'y a pas d'évidence de lien causal entre le vaccin et ces cas-là. Puis que globalement, les bénéfices du vaccin d'AstraZeneca continuent de l'emporter sur les risques reliés au vaccin et surtout quand on considère le risque d'acquérir la COVID-19 en communauté avec les risques de complications et aussi le risque d'effets thromboemboliques qui eux-mêmes sont augmentés par la maladie de la COVID-19.
Oui, peut-être aussi vous entendre sur donc le conseil que vous avez à donner aux Canadiens en prévision du congé de Pâques. Qu'est-ce qu'on doit faire maintenant, là, surtout à l'arrivée du beau temps, tout ça?
C'est Dr. Njoo, je peux répondre à cette question. Comme Dr. Tam a déjà constaté, ce n'est pas le temps maintenant de lâcher ou d'avoir l'assouplissement des mesures de santé publique trop rapidement. On voit aussi peut-être même une légère augmentation des cas, d'incidence des cas dans certaines régions du pays. Et je pense que c'est très important maintenant de continuer avec les bonnes mesures de santé publique éprouvées pendant que les programmes de vaccination continuent de se dérouler. Je pense à certains moments avec le beau temps, et c'est sûr, on encourage toutes les personnes de profiter d'aller dehors parce que c'est sûr que avec l'expérience, on a vu que le risque d'être affecté avec le virus et diminué avec les personnes qui sont dehors, dans les espaces clos, achalandés, avec aussi, comme on dit, pas la bonne ventilation. Toujours, c'est un risque plus augmenté. Donc, on attend le beau temps pour être dehors, mais à part de ça, pour le parc, je pense que c'est pas une bonne idée d'avoir des regroupements de personnes, beaucoup de personnes ensemble. Merci.
Merci. Prochaine question. Next question.
Merci. Our next question is from Melissa Couteau from the Canadian Press. Please go ahead. À vous la parole.
Hi, doctors. Just wondering for clarification on the issue of possible blood clots. Is it just the AstraZeneca vaccine that's being looked at, or are any of the other vaccines being investigated for possible links?
Thank you for the question. This is Dr. Berthiaume from Health Canada. So at this point, there's no information suggesting that there's a higher risk of these very rare adverse blood clots with the other vaccines that have been that are being administered in Canada.
Follow-up?
Yes, sorry. So we're kind of nearing that 10% mark of Canadians who've received at least one dose of the COVID vaccine. What does that, reaching that kind of milestone mean in terms of actually limiting spread of the virus?
Yes, so this is Theresa Tam. So this is still quite a small proportion of Canadians or people in Canada have been vaccinated. I think that what it means is that we should, as I said, see some of the effects in the initial groups that were receiving the vaccine, such as seniors and those in long-term care in particular. And so what's been really heartening to see is a drop in incidence in those over 80, as well as a reduction in outbreaks in long-term care, and that those outbreaks, when they occur, are generally smaller in size. So that needs to be monitored very closely, but is actually really encouraging. And some of the studies that were done by provinces and territories, actually British Columbia and Quebec, for example, demonstrated a high effectiveness of that initial first dose. So I think that, I am very hopeful that if everyone in Canada continues to roll up their sleeves as the vaccine becomes available, which is actually going to escalate pretty fast, that we will be able to see a reduction in individual impact, but also that indirect benefit to others as we protect each other as well. But that is not going to be seen at this point. And there's still data in evolution, if you like, about the impact of the vaccines in reducing transmission or reducing infection rather than reducing disease or serious outcomes. But we expect those to become more available soon. Some of the vaccines, including, for example, the Moderna vaccine, has shown in some preliminary information a reduction in transmission or a reduction in asymptomatic infection, for example, when people swabbed the vaccinees' noses compared to the placebo, for example. So I expect some of those studies to come out as time goes on. Which is right now is that vaccine is a very important layer of protection, but it is only but one layer of protection, and that we need to keep up with the other layers of protection until the vaccine layer of protection is much more reinforced.
Thank you. On a le temps pour une dernière question et un suivi. We have time for one more question and follow-up. Operator, please.
Thank you. Our next question is from Mike Lecouteur from Global News. Please go ahead. À vous la parole.
Thank you for the opportunity to ask the second question. I just wanted to ask that given what you're seeing in the spread, especially amongst younger people, is there any consideration from public health officials to maybe push the provinces or suggest that younger people should get the vaccine sooner to stamp out this spread that is seemingly more of a concern to you?
So I think that the serious outcomes are still going to be felt much more in the higher risk groups. So that's been the focus of public health programs to date. But the concept that we need to get everyone that first dose as fast as possible, and with the vaccine supply that we have, that can be done before, maybe by the end of June, pending, supplies all going according to plan, is basically takes into account that concept, is that you can't completely just protect the higher risk groups without increasing vaccine coverage in the groups that are younger, who may transmit the virus to others. So that's the trajectory, and that the provinces are working really hard to administer those doses as fast as possible. But I do think that younger individuals who perceive the individual risk as lower need a lot more targeted communications and different strategies to incentivize them in getting the vaccine. And I do think that many of them go to work, and many would want to, for example, go back to university in the fall. And so in order to reduce those kind of disruptions, everybody needs to roll up their sleeves. And so, that the strategy of shifting the vaccination towards the younger population, although not the primary strategy, is behind that one dose for everyone as fast as possible.
Thank you. It's Dr. Njoo. Maybe I'll just underline or underscore what Dr. Tam said, and I think I alluded to it earlier in one of my answers. If you look at the provinces and territories, obviously they have the best line of sight in terms of examining their local epidemiology, their local context, and determining how best to vaccinate their population. And if you look at Prince Edward Island, I understand Dr. Heather Morrison, the Chief Medical Officer of Health, I recently had a press conference in which she indicated, based on their epidemiology, the fact that younger age groups are individuals in those younger age groups, especially in frontline sort of service industries dealing with the public, were also, I think, the group that had the highest risk of, having COVID-19 and possibly transmitting to others, that they're also targeting them, along with obviously their high risk seniors, et cetera. So you can see it's starting to be a part of the thinking and sort of the thoughtful approach that the various provinces and territories are undertaking. Thank you.
And one last follow-up, Mike?
Yeah, I just wanted to ask you, for both Dr. Njoo and Dr. Tam, is there any sense of frustration on your part when you look at the rollout and how it hasn't been equally as efficient depending on the provinces? One sort of looks at Quebec and Ontario, where Quebec is seemingly moving the age brackets through the vaccination process a lot quicker than Ontario is.
Well, I think the rollout of the vaccine program is absolutely a provincial and local responsibility. It is complicated, so I think one does have to be a bit patient, and as things get more, moves along more, as the vaccine program moves along more, I would certainly want to see that that acceleration continues, because there's going to be a lot more vaccines coming in the coming weeks, like over 1 million doses in the next several weeks. And that, that's when I think we will see that escalation occur. But it is complicated because, the initial Pfizer and also to a certain extent, the Moderna vaccine has significant logistical issues. Some of that because of the sort of freezer requirements, but some of that has been, those requirements have been reduced. And also with vaccines that might be easier to handle and administer, yes, it's easier to use them, but they need to set up a whole other set of channels to deliver them, given that opportunity. So I think what you'll be seeing is that provinces are going to be leveraging pharmacies and other venues that they haven't done before. So I think, we need to give them a bit of a chance to set it all up. But for sure, I'd like to see that escalation in vaccines, and that there's not too much vaccines that's been delivered that's hanging around. But I think we will see.
Thank you. So this is the end of our press conference for today. Merci d'avoir été avec nous. Je vous souhaite une bonne journée.
Merci.